And we're back on Staying Young for the First 100 Years, and you may notice when we do this show, usually never far away from us is a bottle of water. And from time to time, just because we need it, sometimes to also encourage you, we're going to take a sip no matter what. The doctors taught me over the last, we've been doing this show since about 68, right?
Seems like that long.
Okay. How important water is to the body, and no matter if it's Dr. James, Dr. Kim, or Dr. Jason, we're always going to try and make sure that you know that water is honestly the key to life, and you will see a big change in the way your body responds if you start drinking more water. And I know the doctor want to take this a different direction real quick, but I do want to point out that if you're someone that sits around and it's a lot of sodas, and take it from me, I understand, you're not helping your body at all. And
Exactly.
you know,
And it's not really getting off track a lot, because I read an article, it's been about 6 months ago, and it said 50% of headaches are due to dehydration.
really?
And I thought, wow, that's a biggie. But the report they did indicated that was true. And so drinking water has, you wouldn't think, well, drinking water to get rid of a headache. But if you've got a consistent pattern of a headache, that's definitely the first step you want to do. Make sure you drink plenty of water. The brain matter is a lot of water in our brains. And so when that dehydration factor hits, then you have a reaction to that tissue, and most of the time that reaction's pain. And so it's if you have a consistent headache pattern, and when I say consistent, if you had headaches more than twice a week, that's in my opinion, that's getting severe.
Okay.
Then you need to check some things that you're doing, and water is one of them. A lot of times we talk about the different things we drink, and especially if something's got caffeine in it. Caffeine can initially help a headache, but long term it causes more headaches than it helps.
And if you come off of it too quick, too.
Exactly. And caffeine is it will dehydrate you long term. It blocks the ability of the body to absorb as much of the we think we're taking in a lot of fluids, and we are, but we're not taking in fluids the body can benefit from. And
Okay.
so there's where you get into the different types of fluids we're taking in. But if you can increase your water intake, then you'll see a positive change in usually every function of the body, and a decrease in the total amount of pain that you experience usually.
Okay. So, like we said, you'll see these bottles flanking us each and every show. We just want to remind you how important that is. So, the Dr. James's office is one of those places you can go into, and I don't want to turn this into an infomercial, but there's a lot of offices you go into, and it feels very, very clinical, very antiseptic. And I think that's why everybody enjoys your office, is you walk in, and at one time it was a home anyway.
Right.
So you just continued that that feeling and that thought onto your clients, right?
Exactly. And our office is Taylor Family Chiropractic Office, and so we try to make people feel like family. I treat them like family. If I make a recommendation to a patient, it would be the same recommendation I would make to a family member.
Sure.
It wouldn't be something, well, I'm going to make a different recommendation. If it's someone I love as a
Right.
family, then I'm going to make whatever recommendation I think is necessary for that individual patient,
Right.
and based on that same feelings. And so it's a matter of trying to keep the atmosphere there at a more friendly atmosphere and
Right.
a less formal atmosphere. There's a condition that a lot of people have called white coat hypertension.
Okay.
And what that is when they go to the doctor's office, their blood pressure goes up. And they say it's because they're going into an environment that is puts them on, takes the ease out of, or puts them on a sort of
They feel uncomfortable,
protected
maybe?
uncomfortable
Oh, okay.
feeling, a
Yeah.
protected mode,
Defensive
or
mode.
a little bit more tense. And so when we have a patient come in, a lot of times we'll take their blood pressure. If it's a new patient, we'll check their blood pressure. And a lot of times especially if it's elevated, we'll check it again before they leave. And 99% of the time, it's gone down from the time they came in till they left. But it's, and that's, again, even though, especially a new patient that's never been to a chiropractor, they've heard all kinds of strange things that we do.
Right.
And once they've experienced a treatment in our office, they're relieved in the fact that they, most of the time, got more than they expected. They got relief, and they didn't get hurt, and they just felt better when they left. And so pain, the lack of pain or the reduction of pain can decrease your blood pressure, same as pain can increase it.
Sure.
And so we see a combination effect going on, more relaxed atmosphere, less pain, just like I said, just a friendly place to come.
And I have to admit, I am one of Dr. Taylor's patients. I've been there on several occasions, and I've gone in feeling just horrible, come out in a great deal of stress. Now, not each and every patient is going to be treated differently. That's why they don't have one blanket way that they adjust everybody. I mean, you have, not to use your name as a play on words, but you tailor your adjustments to how the patient is feeling and how they're reacting, correct?
Exactly. I've been practicing for 32 years. My son and Jason and Dr. Kim, my daughter-in-law, have been there for 9 years now. And we all have our different techniques that we adjust. They do a lot of what we call upper cervical technique, which is the upper two vertebrae of the cervical spine, the neck, where the head skull sits on. They key on those two levels initially. They also do diversified technique, which is the same as I do, and they work on the whole spine. But different people respond differently to different adjustments. And so if I get a patient in that is not responding in the way I think they should to mine, then I'll bring Dr. Jason, Dr. Kim in and let them evaluate the patient too. Same way with them, if they get a patient that's not responding the way they think it should respond, then I come in and see if there's anything I can add to what they're doing to get the overall results we want to get with that patient. And generally, between the three of us, we're able to accomplish that the majority of the time. I mean, I'm not going to say everyone that comes in our office, we don't have 100% rate. I don't know of anyone that can, any healthcare professional can document that 100% of success with everybody that comes in.
Right.
But it's a situation where all the reports that we get, all the studies that are done, patient satisfaction in a chiropractic office is greater than most other healthcare professionals.
Is it because there's, for the lack of a better phrase, instantaneous relief?
To a point, that's
Yeah.
some of it, and I think a lot of it is the approach that, well, I can only talk for our office, but the approach we take with that individual patient. You know, we show concern. We are concerned about that patient, and we're not only concerned about that patient in the symptom that they came in for, or what brought them to our office, but any underlying things that may be going on that the patient may not even associate with what's going on with them,
Sure.
that we can help them with. And so it's a combination. And again, we treat them as family, and we care about, you know, the results we get, and we try to be honest and upfront with them.
I'd rather have a doctor who's going to be honest and upfront than sugarcoat it and have me thinking one thing when it's something else.
Exactly. And that's the way, you know, that's the way hopefully the whole world should be.
Yeah. Now, folks, as this show progresses, on the bottom of the screen, you'll see some things coming up, especially if the doctor uses some words that I'm not sure of, as he did in the first show. Had to look those up. But if you would like to ask questions that we can answer on the next show, send it to brian@thebig1063.com. And we'll get to it as soon as we can. And if you're listening on the radio, of course, the number is 248-6565. Just call up, give Larry or myself, whoever's answering the phone, the question that you have, and we'll get it to the doctor. And if Dr. Jason and Dr. Kim can't answer it, we'll have Dr. James do the same, and vice versa. So this show can be seen, okay, on YouTube, on the Big One channel. Just look for We Are the Big One. It'll also be seen here very shortly on LMU Channel 4. And we are looking forward to possibly getting it in a few other venues. We're working on that as we speak.
Great. If you've got a problem out there that you've not gotten success in getting taken care of, we'd be glad to sit down with you and talk to you about it. See if there's anything chiropractic can do to relieve your either the pain or get you get function back. Just sit down and talk to you and give you our point of view of what's going on and what we can do about it.
Okay. It's Staying Young for the First 100 Years, brought to you by 106.3 FM, but even more importantly, Taylor Family Chiropractic. Just that easy, folks. We hope you have a great week. We'll talk to you next week. And don't forget, those questions can go to brian@thebig1063.com. Hope you have a great week. And parting words from Dr. James.
Well, drink your water, get plenty of rest, and get plenty of activity.
There you go. Have a great week, folks.